Welcome children. In this video, I will be dealing with the topic drug and alcohol abuse, and in this video, I will be presenting before you all the presentation put forward by group 6, Annie and team. So with their presentation, I am going to give my running commentary. So let's start. Drug and alcohol abuse. So let's analyze first what is drug or alcohol abuse. Drug and alcohol, when taken for the purpose other than medicinal or taken in amounts that disturbs the physical, physiological and psychological functions, it is called drug abuse or alcohol abuse. There are 5 categories of drugs. We can look into each category and analyze the source, the effects, examples and the mode of its administration. The first category of drugs are the opioids, O-P-I-O-I-D-S. The source of opioids are the latex of poppy. The scientific name of poppy is Papaver somniferum. It is a scientific name, so the genus should start with a capital letter. P should start with a capital letter. Effects: it serves as a depressant. It slows down the body functions. And the example is heroin. It is commonly called smack and chemically called diacetylmorphin. Why it is called diacetylmorphin? It is formed by the acetylation of morphin. It is a white powder which is odorless but bitter. It is administered by way of snorting or by injection. The second category of drugs are the cannabinoids. The source is Cannabis sativa. Again, this is a scientific name. The genus starts with a capital letter and the species starts with a small letter. The effects: it affects the cardiovascular system. Example is marijuana, hashish, charas and ganja. This is administered by inhalation as well as by oral ingestion. The third category, it includes the coca alkaloids or cocaine. The source is the coca plant, scientific name Erythroxylum coca. Effects: it stimulates the central nervous system, producing a sense of euphoria. What is euphoria? It is a sense of well-being, extreme happiness, extreme confidence and well-being. That is called euphoria. And increased energy. Excess dosage will cause hallucination. And what is hallucination is, such persons will feel, they will sense many things. That is, all their sense organs will be working without anything in reality. They feel the presence of a person in front of them. They see, they hear, they smell, they taste and even touch things which are not actually existing outside their mind. And this will result, or this will make them feel nervous, paranoid and frightened. And examples are cocaine, coke or crack. The fourth category are the hallucinogens. The source of this is Atropa belladonna and datura. Effects: it is used as medicines for mental patients for treating depression and insomnia, that is sleeplessness. It is also used as sedatives for patients undergoing surgery. Examples are barbiturates, amphetamines, LSDs and morphines. So this category of drugs are mainly used for medicative purpose, but it becomes psychotropic when we use it for purpose other than medicinal. And this category of drugs are taken by injection. Now we have the fifth category, the common nicotine. The source is the tobacco, and we know which part of the tobacco plant is used for making cigarettes, the tobacco leaves. It affects the adrenal glands which produces adrenaline. Smoking increases the risk of lung cancer and chewing increases the risk of oral cavity cancer. So this can be administered by 2 ways, either by smoking or by chewing. If it is being smoked, it affects our lungs. It causes lung cancer, and if it's chewed, it causes throat cancer or the cancer of the oral cavity. Not only that, by smoking, it increases the carbon monoxide content in our blood. And we know carbon monoxide is a very toxic gas, and because of the presence of carbon monoxide, heme bound oxygen decreases. That is, the hemoglobin bound to oxygen decreases. As a result, the person will show deficiency of oxygen in the body. Example, tobacco, which is available in the form of cigarettes. Even it is available as chewables. Adolescence and drug alcohol abuse. So why do we say with alcohol and drug abuse is associated with adolescence? So first let's define what is an adolescence. Adolescence is the period that links between childhood and adulthood in one's life. The age is between 12 to 18 years and is usually considered as the adolescence age. Causes of drug and alcohol abuse, especially among adolescents, is curiosity, need for adventure, excitement and experimentation constitute the common cause which motivates youngsters towards drug and alcohol use. That's why we see drug addiction and alcohol addiction among youngsters, because of this feel of curiosity, experimentation, adventure, excitement, etc. Second cause. Now this cause is of late the stress, aspirations from parents on the children to excel in the examinations play a significant role in persuading youngsters to try alcohol and drugs. It's a way of escapism. So now this is the trend. Parents are giving a lot of pressure on the children, having a lot of aspiration, ambitions for the child and forcing them to do well in the exams, and therefore the child resort to such substances to escape the situations at home. Another common reason among youngsters to resort to these substances is the feeling of chill or cool. This perception, the perception among the youth that it is cool or progressive to smoke, use drugs or alcohol is also in a way a major cause of the youth to resort to such habits. Even to some extent, this perception is encouraged through televisions, newspaper, movies, internet, etc. So by seeing all these, children think, okay, they are full-fledged adults, it's time to try all this. So this perception is very, very wrong. It's cool or chill to resort to these substances. And the fourth category is very miserable: unstable, unsupportive family structures and peer pressure. Split family or single parent, or families where the parents are not united or not supportive to the child. In that case, they go for all this. Also peer pressure, undue peer pressure also force children to such substances. Addiction and dependence. What is addiction? Addiction is the attachment to the psychological effects of any substance. For example, consumption of drugs and alcohol gives a temporary feeling of euphoria. I told you, extreme happiness, that feeling. People get attached to this sense of euphoria and start consuming drugs and alcohol even when it is not required. If a person is addicted to these substances like drugs or alcohol, he or she should gradually give up on these habits, as sudden discontinuation can lead to withdrawal syndrome. So even if the youngster or the person is taken to a rehabilitation center or a deactivation center, they will not abruptly stop the usage of drugs or alcohol. They give dosages, but they taper the dose. So here what is important is we cannot abruptly stop the usage or discontinue the usage of drugs. Once caught for usage of drugs and alcohol, it's better not to abruptly wean him from drugs or alcohol. Slowly in small doses it should be given. This is what is done in the deactivation center. Or else what will happen, the victim will suffer from withdrawal syndrome. We can see what is withdrawal syndrome. The person suffers from extreme anxiety, diarrhea, tightness in the chest, sweating, difficulty in breathing, shivering, and becomes very fidgety. So care should be taken in handling such victims. which gone beyond the control of the parents and friends, it should be dealt by a psychiatrist at the deactivation center or rehab center. Warning signs. So, when you observe some warning signs among your peer, it is an alarm for you to inform the parents or the teacher or a confidant. Drop in academic. So, now we can analyze some of the warning signs. Drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressiveness and rebellious behavior, deteriorating relationship with family and friends. So, very outstanding, we see those children who resort easily to vandalism and violence. That and all is developed because they are into these drugs. They get an extra confidence and energy. Some more warning signals are there to this list. Loss of interest in hobbies, change in sleeping and eating habits, and fluctuation in weight and appetite, etc., which is unexplainable. So, weight loss and appetite which is unexplainable. Effects of alcohol and drug abuse. First, we will deal with the harmful effects of drug and alcohol abuse. The first and foremost harm of drug abuse is that the most common method of administering drugs is intravenously, that is through injections. And these drug addicts, they share the same needles. It's not that they're using disposable needles or they're sterilizing the needles. They have no time for that. They'll be passing the needles. So, there's chance of them to contract dangerous diseases like AIDS and hepatitis B. It is transferred from one person to another by the sharing of needles and syringes. So, they are more prone to such diseases. The second, the chronic use of drug and alcohol can damage the nervous system. So, they become chronic users. It will damage the nervous system and also results in liver cirrhosis. This is very, very fatal. It can lead to death. The use of drugs and alcohol during pregnancy is also very dangerous. It adversely affects the fetus. The child becomes deformed. You must have seen children or beggars on the road with flippers, the hands abruptly, not amputated hands, just cut hands. That is, they are born deformed. Even it will result to mental retardation. Now, we can see some side effects in both the genders. First, we will analyze the side effects in females. The females who resort to steroids, anabolic steroids, what and all features they develop. Masculation, that is features, a lot of features, masculine features they develop. Increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris and deepening of voice. And now the side effects in males which are parallel to females. Acnes on the face, increased aggressiveness, mood swings, depression, reduction in the size of the testicles, decreased sperm production, potential for kidney and liver dysfunctions, breast enlargement, premature baldness, enlargement of the prostate glands. And in both genders, common features, severe facial and body acnes, premature closure of the growth centers of the long bones which may result in stunted growth. Now here an age-old adage stands true, prevention is better than cure. So now let us look into some preventive measures, also some control measures. The first measure, counseling and education are one of the best ways of dealing with cases of alcohol and drug abuse. Avoidance of peer pressure could help in bringing down these habits to a large extent. Then, help from family and friends could do a lot of damage control as people are closer to family and friends, hence talking to our loved ones help in coming up with such situations. So, you always open up to a confidant of yours, your family member or your friend. And when it goes beyond your level, that is you have reported to the teacher, counselor, when it goes beyond, if the person is a chronic user, then we have to take him to the higher level, a psychiatrist, where he is put into a rehabilitation center or deactivation center. So there are many such rehabilitation centers or deactivation centers launched to help alcohol and drug abuse patients from exerting control over the impulse to use drugs, even when these are having negative consequences. So in this context, I say good parenting plays a very important role. Parenting combined with high degree of nurturance and consistent discipline will never make the child to fall in such traps. And also children, be very assertive to give a no to peer pressure. The no should be an assertive no, not a pleasing no. So you will not easily be a prone or victim to such substances. And once you try or take drugs, once as a trial of experimentation or curiosity or for adventure, it becomes a forerunner of addiction. And once you become addicted, you are pulled into a vicious circle and you are controlled by someone of another level. So better don't give a try even for the first time. Remember, bear in mind it becomes a forerunner to addiction. I hope you have understood this topic, and once again I thank the group that helped me in presenting this video. It was purely done by Annie and team, 2021 batch. Thank you. Anna, Annie, Christina, Ekna and S. Nandana.